Let's listen to an expert doctor for hypertension in young population along with coronary artery disease and higher heart rate can be sure of happy heart. Today we have Dr. Vamsikrishna Raju Kosuru, consultant interventional cardiologist and specialist in heart failure, have 7 years of experience in cardiology. Currently working as consultant in Pulse Hospital at Vijaya Bharati Chest Institute, Rajamundry. How do we define hypertension and when should we conclude that the person has hypertension?
Defined according to the International Society of Hypertension in 2020 guidelines, so we can conclude hypertension by systolic BP if it is more than 140 millimeters of mercury and diastolic BP of more than 90 millimeters of mercury. So less than 130 by 85 is considered normal, and in between 130 systolic to 139 systolic is considered high normal, and more than 140 systolic is considered hypertension. And coming to diastolic pressure, 85 to 89 is considered high normal, and more than 90 millimeters of mercury is considered. And it sometimes varies in whether BP monitoring is whether home BP monitoring or ambulatory BP monitoring. In ambulatory BP monitoring, the values are little different, like 130 by 80 in average blood pressure is considered as hypertension.
Can high blood pressure be completely cured?
Yeah, high blood pressure, in some cases we can completely cure. Not all cases it is curable. Some cases it is curable. Like depends upon the hypertension etiology. So it is mainly of two categories. Either it is primary hypertension or secondary hypertension. If it is secondary hypertension, that means if it is secondary to some other medical conditions caused by some conditions like endocrinal disorders or renal issues or obstructive sleep apnea or polycystic ovarian syndrome or some conditions like coarctation of aorta, all these conditions, if you cure the primary reason that is causing hypertension, then it is completely curable. And if it is primary hypertension or essential hypertension, which is mostly observed in 90% of cases, it is not completely curable, but we can control the hypertension.
Has there been any recent increase in the incidence of hypertension and heart attack among young patients? If yes, what could be the underlying cause?
Yeah, nowadays there is a drastic increase in the cardiac events along with the hypertension incidence. And one thing is because of the lifestyle changes which has been drastically changed in the latest century, and there is increase in the incidence of the diabetes along with increase in the incidence of obesity and drastic change in the food habits like increasing in salt intake and decrease in fruits and vegetable intake. That is causing more incidence of the hypertension. And that too, these incidents we are seeing in more younger individuals. Not only the more number of cases, and it is coming down in the age.
Thank you, doctor, for your time.